Hey y'all, this is Michaela with Hospice Nurse Basics. And today I'm coming to you guys with a video to discuss the differences between hospice and palliative care. And the reason why I'm making this video, y'all, is because I've recently met with a patient who believed I was coming by to see her to discuss palliative care. However, the order that I got said to evaluate and treat for hospice care. So imagine how the patient felt when I'm coming by for a totally different reason than what she believed. And for me, you guys, it is so important for me to be transparent when I meet new patients and families because ultimately I'm here to build a good rapport and a trusting relationship. And I do know that some healthcare providers will intertwine these two words as if they have the same meaning, but they're totally different. So my hope is today that if you are a healthcare provider, or if you're a patient yourself or a family member who's thinking about hospice or palliative care, hopefully this video will help you when it comes to deciding which one is best for you and your family. Let's get straight into it. So here we have Dr. Gray and her patients, Ethel and John. Now, Ethel and John both have a diagnosis of lung cancer. For John, he is here today to discuss the results of his recent PET scan, which shows great results. The tumor has shrunk and the growth rate has slowed down. Now, during his visit with Dr. Gray, John has also voiced that he's having pain in his lower right back. He's also having some feelings of nausea after his chemotherapy treatments and is wondering if he can have anything to help with the symptoms. And then we have Miss Ethel, who over the last few weeks has missed her chemotherapy appointments and states she cannot handle the side effects any longer. She is always tired, has constant diarrhea, and no appetite. And at this time, she wishes to stop chemotherapy. And she fully understands that there are no other treatment options for her. But at this time, it's more important to Ethel to just feel better versus being sick and not feeling well every day. As their healthcare provider, Dr. Gray is going to write an order for palliative care for John, and she's going to write an order for hospice care for Ethel. Now let's take a look and review the similarities between these two services. Now both hospice and palliative care do require that the patient has a terminal or life-limiting illness. However, in John's situation, his condition is more life-limiting. Remember, the PET scan showed improvement. So again, at this time, his condition will be considered a life-limiting illness. In addition to that qualification, both hospice and palliative care focus on symptom management. For Ethel, her diarrhea and no appetite, those symptoms can be managed with the hospice program. And for John's back pain, his palliative care nurse can also manage that symptom. Now, both programs also provide an extra pair of eyes and ears and allows a healthcare team to report back to the healthcare provider and update the healthcare provider on the patient's health condition. This way, the patients do not have to come into the doctor's office for every symptom that they're feeling. They can simply call their palliative care team or hospice team, who can come out and do an assessment and manage those symptoms, and they will report the health condition to their healthcare provider. And overall, the main focus of both hospice and palliative care is to improve the quality of life for the patient, especially while they face this terminal or life-limiting illness. So we've just reviewed the similarities between hospice and palliative care, but let's review how they're different. Let's start off with hospice. So one requirement for hospice is that the patient must have a 6 months or less life prognosis. Now, when I say that, that does not mean that the patient has to pass away in 6 months. A lot of people think that, but y'all, let's just be honest. Only one person knows when we're going to pass away. What this means is if the illness took its normal course, that there's a chance that the patient could possibly pass away in 6 months. They have a 6-month prognosis. However, that differs for palliative care. A patient is able to receive palliative care services at any time during the illness. They could have a prognosis of 2 years or 2 months. It doesn't matter. A patient is able to receive palliative care services at any time. Now, another difference between hospice and palliative care is that when a patient decides to go on hospice care, that is when they have made the decision to no longer seek curative treatment. This is when the patient, like in Ethel's example, who has been told that there is not another treatment option available. For Ethel's situation, she tried chemotherapy and was not able to handle the side effects. And radiation or any type of surgical procedure was not an option. So at this time, Ethel is not seeking any type of curative treatment. However, for the palliative care patient, John, he is still doing chemotherapy, which is considered a curative aggressive treatment, and he's still getting his PET scans to check on the status of his tumor and cancer, that which is also considered curative treatment. So that's another difference. One program is when you want to continue to be aggressive, and the other one is when you have chosen to no longer be aggressive. So another difference between hospice and palliative care is the way they look at quality of life. So for hospice, their main focus is to provide a great quality of life as the patient enters the end stages of their life. While for palliative care, their goal is to also focus on quality of life, but they want to maintain a great quality of life for their patients as they continue to fight the life-limiting illness that they have. So I think it's always important when you get to know a family or a new patient to ask them, what does quality of life mean to you? You may notice that for your hospice patient, they just want to be pain-free. They want to be safe and die in dignity, or die with dignity, rather. Versus your palliative care patient, they may just want to be physically and mentally independent. They want to be able to travel or go to their grandchildren's game on the weekends. Their focus and quality of life goals may not be the same for the hospice patients. But that is another difference, is the way they focus on quality of life and help ensure quality of life for their patients. Another difference between hospice and palliative care is that with hospice care, you do have medical care or medical personnel available to you 24 hours a day. So even if there's a medical emergency at 2 a.m., you always have a nurse available that can come out to the home and do an assessment and help you with your symptoms or any conditions that you may be experiencing. However, with palliative care, if you have a medical emergency in the middle of the night, As you should have access to on-call services, most companies will allow the palliative care patients to call, but they will not make a visit on call. If you truly have a medical emergency, you will be asked to call your healthcare provider or go to the hospital. The only time that I've seen the hospice team come out on call for a palliative care patient is when a palliative care patient is ready to transition to hospice care. Lastly, the last difference between hospice and palliative care is the way that it's paid for. So hospice is covered at a 100% rate under Medicare, Medicaid, and some private insurances. However, from my experience, Medicare also covers palliative care, and sometimes Medicaid and private insurances will as well. However, those patients will have to pay a copay. So if there's a copay for office visits under your insurance policy, that same copay will be due when you receive a palliative care visit as well. So we just gone over some differences and similarities between hospice and palliative care. I do want to mention that there are more differences. I just weren't able to fit them into my Venn diagram. But another difference between the two is that under hospice care, the nurse is able to come out as often as needed. Actually, any hospice discipline is able to come out as often as needed for the hospice patient, just to make sure that their needs are met. However, for palliative care, from my experience again, you typically only get one visit per month from the nurse practitioner. Now, that you will have access to the hospice chaplain and social work. But again, they don't make visits often. It's usually on an as-needed basis. And then the nurse practitioner will make a visit monthly on palliative care. Again, for hospice care, any discipline is able to come out as often as needed, as long as the patient's needs are met. So I do hope this video was helpful and that it kind of gives you a better idea of the differences and similarities between hospice and palliative care. Please, if you have anything additional that I didn't mention on the video or anything to comment, please leave a message down below and I will definitely respond. Also, this is a community, so if you have anything that you can provide to help someone that could be interested in hospice or palliative care, and just share your knowledge, because people come to this video all the time and they just want information. So if you have anything to add, please leave a comment. And again, please like, share, and subscribe. And thank you for watching Hospice Nurse Basics videos. We'll see you guys in the next one.